Good morning. Thank you for this question. I'm Dr. Demestri, board certified plastic surgeon, going over tummy tucks, ideal weight, effect of visceral fat on the final result. So some people definitely do have a BMI cutoff for their tummy tuck patients. I personally don't. I do care that you're in good health, that you don't have uncontrolled medical conditions. But as far as BMI goes, it's really not a very accurate predictor of your overall health, of your overall end results. And so that's something that we would discuss as far as expectations for final results, depending on starting BMI point. Now, the impact of visceral fat, meaning the fat that is around your organs, does play a huge role in your final tummy tuck result. And that is absolutely something that I will kind of caution you to as far as expectation setting for the result. So what is visceral fat and why does that impact things? So on this diagram, we're basically looking at the amount of fat that lies underneath your abdominal wall. So the layers of your abdomen from the side is you've got your skin, that's your belly button, then you've got fat underneath the skin. Then you have your abdominal wall, which is made up of your ab muscles and of this strong connective tissue that ultimately separates your inner organs, your inner contents from the outside world. Now, some people have a very round belly, but when I pinch the skin and the fat on top, it's actually pretty thin. There's not much there, and that rounded look from the side is due to the visceral fat that is pushing out. Now that is to be distinguished from pooching that happens from rectus diastasis. So when you've had kids, you've had that stretch between the muscle that weakens the abdominal wall, and ultimately you can get some roundness from that. But that's separate from if all of that roundness is because this area is full. It's full of fat, it's full of your organs, and I can't access that. You know, you can't go liposuctioning around the organs, you can't cut any of this out. So if this is pushing all of that pressure in, then there's nothing I can do about it. So then if these people come to me for a tummy tuck, say they have just like a little bit of overhang here, and I cut that skin, I pull everything down, and say I liposuction this away, their contour is still going to be very rounded and doesn't get any of that flatness that you would. How can you distinguish between visceral fat and bulging from rectus diastasis? Well, one, when you lie flat with the diastasis, it's really squishy, it's soft, you can push everything back in because it's not an issue of having too much stuff on the inside. This is relatively empty, but this pooches out because it doesn't have the abdominal muscle support. So in the case of visceral fat and a lot of pre-existing roundness that's quite firm, I don't recommend going for a tummy tuck right away. You're much better off going through a weight loss program, losing weight in a slow, healthy fashion, which predominantly targets this unhealthier visceral fat, deflating that, and then dealing with the skin and fat on top of it. Now, a great tummy tuck patient has minimal visceral fat. So their abdominal wall is actually quite flat when you look from a side view, but they may have overhang of skin, fatty tissue. And now in this case, when I take off this whole chunk of skin and fat and I pull the rest tight and I do some liposuction to thin this, now you end up with that really nice flat contour from the side. So it's less about BMI. You may have quite a lot of excess that is residing above the abdominal wall. In that case, you're a great tummy tuck candidate. You can look really nice with your figure. Or you may mostly carry your fat inside with visceral fat, in which case you are not a good tummy tuck candidate, and your best bet is to lose some of that visceral fat first and then deal with any looseness. I hope that helps. Leave any questions that you may have regarding tummy tucks or anything I just discussed in the comments. Have a great day.